So once you get to 37 weeks onwards, so that means you're fully term, you are cooked. Remember, it's normal to have a baby anywhere from 37 to 42 weeks. That 40-week due date is not a due date, it's a really dumb name for it. It's a 40-week estimated gestation date, but you are due to give birth anytime from 37 to 42 weeks. But okay, once you get to fully term and you're at 37 weeks onwards, when is it appropriate to be contacting your midwife or your LMC? Sorry, that's a term, a local term. Your midwife or your obstetrician. So there's basically 5 main things that you would be contacting them on. And that is 3 of them are concerns of the pregnancy or the baby, and 2 of them are to do with your latent and active labor. Okay, so these are the 5 times that it's really quite important to be contacting your midwife or obstetrician once you're fully cooked, your term, you're over 37 weeks. Okay, so the 3 things to do with you and the pregnancy and the baby at the beginning. So number 1, frontal headaches, or liver pain, or visual disturbances like seeing dots. Liver pain, now your liver is underneath your right rib cage, so usually it's a pain that's sort of underneath the front of your right rib cage, or sometimes it can radiate around to the back, the flank pain, but it's on that right side of your body, generally. And if it radiates around to the back, to the flank pain, it can almost get potentially misdiagnosed as like a kidney pain, but it could be that liver pain. So frontal headaches that just won't go away, liver pain, or visual disturbances, and all of those 3 things are potential signs of preeclamptic toxemia. And the very first thing that needs to be done is your blood pressure needs to be checked. Now, if your blood pressure is normal, then those signs are not, you don't have preeclamptic toxemia. But if your blood pressure has got elevated, because right now you're at high risk of it at this gestation, then they would then go on and do some blood tests to check your liver function and your renal function, and some urine collection, and really assess it to see if you do have preeclamptic toxemia. Okay, number 2. If you get driving you nuts, itchy palms of your hands or soles of your feet without a rash, and they're worse at night, but it's like you can't sleep because they're so freaking itchy. Now that is a sign, a pretty clear sign that you've probably got cholestasis of pregnancy. And this is a liver disease. It can get quite serious quite quickly. And again, you need a couple of blood tests to confirm if that's what's going on. And it's the bile acids in your blood, the high levels of bile acid in your blood, which is a side effect of the disease. And that's what makes your palms and your soles itch at night. Okay, so number 3, reduced fetal movements. So we used to years ago talk about women keeping a kick chart in their late pregnancy. So as long as they got at least 10 kicks or 10 sets of kicks a day, then they go, yep, my baby's fine. But that's a little old school, and our knowledge is a bit more refined since then. So what you're looking for is a uncharacteristic change in the fetal movements. For some babies, they've never been that busily active, or maybe it's the mother's got a higher BMI, and there's an anterior placenta, and she just can't feel the fetal movements in the same way as a woman who, say, has a very low BMI and a posterior placenta. So what we're talking about is the change of movements. And sometimes you get babies who are just quieter personality babies, and at the peak of movements, that mother may only feel sort of 10 or 12 movements a day. So if she has 10 or 12 movements typically in 24 hours, it's sets of movements that she feels, and that's reduced to 9, I wouldn't be freaking out. The fact that it's gone below 10, you've probably missed some movements while you were sleeping, perhaps. However, if you have a baby who usually moves 40 or 50 times a day and they go down to 12 movements, that's of concern. Okay, so it's that change of fetal movement patterns. Now, at the same time, it is common in late pregnancy when the baby is literally running out of room, that the vigorousness of the movements might reduce. So instead of the baby able to go into the side of the room, they can just go, because there's just not so much room. But so yes, you get that, but what we don't want to see is a reduction in the frequency of the movements. Okay. Right. So the next two, those were the three to do with the pregnancy and the baby, and this is now the two to do with the labor, and labor and latent and active labor. Okay. So if you have been awake most of the night in latent labor, or perhaps your waters have broken overnight, or perhaps you've had some bloody show overnight, you don't need to be contacting your midwife late at night to tell them that, and you don't need to contact them first thing in the morning to tell them that. Firstly, you don't want to, if you're working with a midwife or obstetrician who is a 24/7 on call person, which a lot of the case-loading self-employed midwives are, please don't be ringing her late at night to say you've had a bloody show or you've broken your waters when nothing else is going on. She may have just got to sleep, and now she's going to have some serious difficulties returning to sleep. Okay, and what's she going to do about it? There's nothing to do. Being established into labour is all about the strength and frequency and length of the contractions, not about whether your waters are broken. Waters can break, 2 weeks before. 2 days before babies are born, and you can have bloody shows 2 weeks before babies are born. So that is not a reason to call her or him late at night. And the same thing, please don't do it first thing in the morning. Don't go, it's 7:30, I'll give them a ring. Yeah, don't do that. She's just had a baby overnight, or maybe she has, and she's just crawled into bed at 5 o'clock, and you're going to wake her 2 hours later. Don't do that. You don't need to. So please don't. Please don't. So speaking from someone who was a 24/7 on-call midwife for many years. Okay. But, do let her know during the course of that day, sort of mid to late morning, say 10:30, 11 o'clock, drop her a text and say, hey, just to let you know, my water's ruptured overnight, blah. And, or just to let her know, hey, I had a bloody show. That's great. Or, hey, I've had a few contractions overnight. They're only 5 minutes apart. They're only 20 seconds long. But anyway, just let you know. So that's great. That's all need is a heads up, and then she'll contact you back when she has a moment, she or he, and you'll touch base and connect. Okay, then the last one, the fifth one, is if you're actually established into active labor. So this is when you're having 3 to 4 contractions every 10 minutes. They're all over a minute long that you can't talk through. So once you are having 3 to 4 contractions every 10 minutes, all over a minute long, that you can't talk through, you have just started active labour. You've just established into active labour. That's typically not, if with a first baby, that is typically not the time to suddenly hop in the car and drive to the birthing suite, because if you do that too early, your labour could stop. Because you'll get a hit of adrenaline in the car, and then you arrive at birthing suite and you'll be saying something like, well, contractions were every 3 minutes when we left, and now they're every 8 minutes. So with the first baby, it is better, in my opinion, and a lot of people's opinion, just to have that first hour or two at home to really properly establish into having the 3 to 4 contractions every 10 minutes. Now, it is very different with a second or subsequent baby, and you will be talking directly with your midwife or obstetrician about when they want you to phone them with a second or subsequent baby, because they can be a lot quicker. And usually, so, but I'll leave it at that. Anyway, hopefully that's really helpful, and I want to wish you a wonderful rest of your day, rest of your week. Bye, everybody.